We are sure that the useful information shown in this video will allow you to make the correct decision. Liposuction. Having a perfect figure has become the goal of many people making the decision to have liposuction. This is a surgical technique designed to reduce localized deposits of fat that neither diet nor exercise can remove. It can be done on various areas of the body at the same time, or even in combination with other surgical procedures. In the human body, fat acts as both an insulator and a storage of energy as hydrocarbons. Adipose tissue manufactures, stores, and utilizes this energy source during exercise, and also acts as a vital reserve. Fat cells increase in size and number up to the end of adolescence. After that, the accumulation of fat usually results in the increase in size of each individual fat cell. Thanks to the technique of liposuction, the number of fat cells can be reduced, a result which is usually permanent. Each remaining fat cell can, however, get larger or smaller. Fatty tissue is composed of a surface layer and a deeper layer, separated by a thin layer of connective tissue. In general, it is the deeper layer of fat tissue that responds well to liposuction. The location of fat on the body is quite different between men and women. This is because of the difference in hormonal stimulation and genetic predisposition. Liposuction is performed mostly under local anesthetic. It can, however, also be performed under intravenous sedation or a general anesthetic, but always as a day case. The equipment used in liposuction has become more sophisticated, including the use of laser ablation of fat cells, or smart liposuction, and body jet liposuction. Liposuction consists of a vacuum pump connected to a cannula, which is a hollow tube with a rounded tip with a number of small perforations at the end, which allow for the aspiration of the fat cells with the minimum trauma to the body. The cannula is introduced into the body through small incisions on the surface of the skin, which, depending upon the areas being treated, are hidden from view or where they are very inconspicuous. A number of incisions are required for each area being worked on to allow fat to be removed in different directions. Introducing the cannula through an incision, the surgeon manipulates the cannula to and fro through the depths of the tissue, creating tunnels and sucking out the fat. This procedure is also carried out through the other incisions, crisscrossing the tunnels in order to give a more gentle and more even removal of fat. This causes the skin to contract and tighten, allowing it to mold better to the new contours of the body. When the operation is completed, you will be fitted with an elastic garment that compresses the treated area. In addition, it is recommended that the treated area is massaged to stimulate the lymphatic drainage.